Hello everyone, welcome to Med Decoded by Dr. Abul. Now, continuing with the series of MCQ which we posted. So, the question was, we have a young adult from a malaria endemic region. Now, this is the clue. He is from a malaria endemic region. He presented with fever, weakness, and abdominal fullness since several months. On examination, he had a firm non-tender mass in the left hypochondrium, which is likely to be spleen, right? So the patient has got splenomegaly, okay, and the ultrasound abdomen is showing this is the splenic border, and you can see massively enlarged spleen. So the question is, what is the most likely laboratory finding, right? So now, as you know, the USG report again grossly enlarged spleen with altered echo texture. Okay, liver was normal and there was no evidence of free fluid. Now, when you remember, you have if you have a malaria plus you have a big spleen, then you have to think of something called as tropical splenomegaly. Okay, tropical splenomegaly. And what you get in tropical splenomegaly is markedly elevated serum IgM levels. Now, continuing with the disorder, that is your splenomegaly syndrome. So, you've got a hyperreactive malarial splenomegaly. Now, remember, it is hyperreactive. It is response to repeated malarial infections, that is chronic malaria. So, it is a chronic response. It is an exaggerated immune response to repeated malarial infection leading to massive splenomegaly, because spleen is one of the lymphoid organs, right? So now, what are the clinical features? You can get a massive splenomegaly that is usually more than 20 centimeter. You can have till umbilicus, or it can be crossing the midline. So this is one of the important, or rather the hallmark feature, that is why called as TSS or tropical splenomegaly syndrome. So it is still umbilicus and it can cross the midline. You can get hepatomegaly as well. You have anemia. It can be due to malaria itself or secondary to splenomegaly. You can have fever, weight loss, abdominal fullness, and increased susceptibility to infections, right? So these are the few of the clinical features. Important thing or question which is asked is increased serum IgM levels. Now remember, although it is a chronic exaggerated response, it has got increased serum IgM levels. Now, there are high anti-malarial antibody titers suggestive of an exaggerated response. Okay. Now you can have pancytopenia due to hypersplenism. Now PS may or may not show malarial parasites as they are sequestered in spleen, right? So as you know, it is common with P. falciparum. So falciparum has got PFMP, falciparum membrane protein, and it falciparum gets sequestered in spleen. So you may or may not have the PS may or may not show malarial parasites. Now this is an important question, right? Although it is due to malaria, the PS may be normal. Now there's a modified Brighton criteria or the diagnostic criteria. First is the massive splenomegaly, which we saw. Now elevated IgM levels, we understood that. Again, high malarial antibody titers and exclusion of other causes like lymphoma, leukemia, Kala azar, right? These are common causes of massive splenomegaly. So you have to exclude all of them. And you can have a reduction in spleen size after prolonged anti-malarial therapy, right? Again, causes is repeated exposure to, as we know, P. falciparum, which is common in tropics. Treatment, now if the patient, you can give long-term anti-malarial therapy like chloroquine where it is sensitive, or ACT if it is not sensitive. Now, malaria prophylaxis is very, very important. You can have vaccination as well. And if the spleen is very enlarged, there is persistent leukopenia, thrombocytopenia, then you can opt for splenectomy, but it is rarely required. Why? Because spleen is a lymphoid organ. If you remove it, you can get infections as well. Now, what are the complications? Again, you can have severe anemia, you can have hypersplenism, so cytopenias, splenic rupture, which is rare, and increased risk of infection. So, what is the key exam point to be noted? Remember, if you have a massive splenomegaly, if you have a malaria endemic region, chronic P. falciparum, and very high IgM levels, always think of hyperreactive malarial splenomegaly, that is your HMS, or you can say tropical splenomegaly syndrome or TSS. Okay. Thank you.